So I would like to ask the speakers, in the light of your research and your experience, what are, in your opinion, the physical or social characteristics of a favorable environment for the well-being of children in a given community? We will start with Katherine. So, Katherine, you can sit down or stand up if you want. Katherine is in blue. I would like to see the people in the room. Can you hear me? It's a great pleasure for me to be here, especially since I admire Dr. Julien. I've been working at his foundation for some time now, so it's a pleasure for me to be here. I would like to share my thoughts on major projects I'm involved in right now. One is particularly relevant for you. It's a project I'm working on for 5 years now. It's a criticism of the way public health uses game as a social practice for children to make them move. The argument here is that there is an undesirable an undesirable impact of using a game, in fact, to have children move. I'll come back to my criticism in a few moments. So, second project is a project on social inequalities in Montreal, where I explore the physical and social environments and their impact on the social inequalities. At the end, this afternoon, I would like to share with you my thoughts on the issue of accessibility. This is what I would like to cover in 5 minutes. First of all, with the game playing, I think that this is what is most interesting for you. In my opinion, to create physical and social environments that will be favorable to game playing for children, we would have to create spaces where parents are not afraid for their children. And I use deliberately this word fear, because in public health, but in the society at large, we are afraid. We are afraid that our children will be hit by a car, that they will talk to strangers. We're afraid that they will be injured. And this is new. 15 or 20 years ago, we did not have these fears. So the question we should ask ourselves is it really dangerous or more dangerous than in the past? What data tell us, apart from the car accidents, and Mr. Drouin will address this later on. So the life of children is not less safe. There is a problem existing for parents who think that their children are constantly facing danger. And this is a very important point, because it would be our responsibility to create spaces where parents would think that their children are safe, so that children can move freely in their game playing. And this is my second point. In fact, it's very paradoxical. To be well psychologically, socially, and physically, children have to be able to take risks, physically and also socially, which means that they need to be left alone with their friends, not to always be in the eyes of their parents, that they have to be allowed to get injured. And there is a paradox between the first point and the second one. I guess you're following me. We should try, and this is my opinion, and this is a paradox I'd like to hear you on. How should we create safe environments and simultaneously not too safe, so that our children could still be children and be able to take risk? So this is my second point. The third, which is related to these two, is that these environments should give the opportunity, not directly but also indirectly, should ensure that our children be active, that they should climb trees, that they could climb mountains, that they could use their bike, that they be free in urban and rural environments. This is my third point. How can we foster this? In my opinion, once again, we should focus on autonomy. We should create the idea that children have the right to make their own decisions, that they should not always be guided by their parents, that environments in parks can be created so that this is possible. Set up parks where children can get lost. And this is very good to reinforce the autonomy of children. And Mr. Drouin will probably address the idea of reducing the use of car and increase walking and biking for children to have them more active. Children can walk together with their friends or with others between their home and the schools. This, unfortunately, doesn't happen nowadays, and it's very sad. Then the third point, how should we involve children? Well, children know that they are restricted in their games. Part of the project I conducted with my student, Mrs. Alexander, was to ask children what they like when they play, what kind of games they like. Many children said that, first of all, they wanted to do what they wanted to do. Oftentimes, these things were non-active. For example, knitting. And we should let the children play as they wish. So in communities, we use children to tell us what the hurdles are and what they see as opportunities to do what they want and to play as they wish. My last point deals with this question or this issue of accessibility. This is based on my experience on other projects. When we have resources, for example, parks, it is not certain that everybody will use it the same way. And it's particularly important for the Dr. Julien Foundation, which is particularly interested in children from disadvantaged neighborhoods. Oftentimes, the resources for children are not used for the same purpose depending on their school education. So we have to create spaces that will meet the needs of active children and create opportunities for children to use these spaces.